Welcome again to this week's episode of LDN ONT TV here on Rogers TV. I am your host, Bronagh Morgan. And just a reminder, this is the show where we talk about what you're talking about. So what our viewers and what Londoners and Southwestern Ontario viewers are talking about. And there is definitely a lot to talk about on the issue we're covering today. It's the ethics of vaccine mandates, and all things COVID. We are so fortunate to have as our guest today, Dr. Maxwell Smith. Now, Dr. Smith has many roles, so I'm just gonna read and make sure I get them all right. He is an associate professor at the University of Western Ontario in the Faculty of Health Sciences. He is also associate director of the university's Health Ethics, Law, and Policy Lab, and he is a member of the World Health Organization's Ethics and COVID-19 Working Group. So I'm sure you do a lot of things in your spare time as well. So fortunately, we have you for our broadcast today, and thank you for making the time. Thanks for being here, Dr. Smith.
It's a real pleasure to be here. Thanks, Bronagh.
So it would be impossible for people to have missed the debate surrounding, mandating vaccines for our population. Everybody's talking about this right now. It's in the news. It's all over Twitter, which is, the basis of a lot of the topics that we cover on our show. Talk to me about maybe the role of somebody in your position as an ethicist and a university professor. Let's get started. Let's take a kind of a high level approach on, how you got so involved in working with this issue in particular.
Yeah, I mean, really, bioethics is a discipline that thinks about ethical issues in relation to medicine and health. And, there really hasn't been a lot of focus on ethical issues and ethical considerations in the practice of public health. And this is slightly different than medicine and healthcare. It's collective actions that are taken to promote and protect the population's health. So oftentimes this comes in the form of laws and policies that happen at a system level. So you can think about things that preclude or prevent people from polluting, or traffic laws and all sorts of other food inspection laws, things that happen sort of out of sight, out of mind, to really help control and promote population health. And so a lot of the ethical thinking around public health measures, which we use in response to infectious disease outbreaks as well, concern this relationship between the government and its people, and how much can the government interfere in people's lives in order to protect their health and promote their health. And so really, this is the basis for a lot of ethical thinking in public health. And so a lot of this translates very straightforwardly into thinking about whether the government or institutions like hospitals or universities can require people take measures like be vaccinated in order to promote and protect other people's health. And so that's really how I got into thinking about ethics in infectious diseases, and thinking through whether requirements for vaccination can actually be ethically justified.
Understood. And when you talk about the government, we're talking about all levels of government, I'm assuming.
Yeah, that's right. I mean, public health exists at the federal level. We have, of course, Health Canada and the Public Health Agency of Canada thinking about the public's health insofar as they are analyzing, reviewing, and approving the drugs and vaccines and diagnostics that get approved for use for people in our country, as well as looking at our borders and making sure that we're controlling the spread of infectious diseases, amongst many other things that they do. Of course, provincially, we have to think about how the province is responsible for a lot of our public health system. We're all pretty familiar, I think, these days with Dr. Kieran Moore, our Chief Medical Officer of Health, who has to make system-wide decisions to protect and promote the health of populations. But then we can also think about the province's 34 public health units. That's the regional health units that are responsible for more regional health. And here in London, that's the Middlesex London Health Unit. And they need to make decisions about how to protect and promote the health of Londoners. So really, it's this across the system, across many levels of government, working together to think through the best ways to protect and promote people's health.
And interestingly, when we talk about government as well, it's not just elected people. It is everything that works within, I guess, the government-funded system. So decision makers that are maybe not the ones we chose, but the people that are hired that are also part of this, I guess, larger picture government that we have to look at. And I guess, as citizens, wonder if the decisions are being made in an ethical framework.
Yeah, this is where ethics, which is otherwise termed moral philosophy, interacts with political philosophy. Moral and political philosophy often come together because we need to think about how these decisions should be made. In Ontario, I think most are becoming more and more familiar with Ontario's Science Advisory Table. This is a group of scientists who are experts in this area, and they provide advice to the government about how we ought to respond to particular issues, whether we should keep schools open or close them, whether we should mandate vaccines or not. And sometimes people are surprised to learn that they don't actually make decisions, right? They are the Science Advisory Table, but it is ultimately our cabinet and Premier Ford who makes many of our health systems decisions. And, I think that's the way it probably ought to be, because we live, after all, in a liberal democracy, and we've elected those officials, and they are the ones that are meant to be accountable for the decisions that we make. They're not necessarily going to be expert in all of these issues, but we hope and rely on them to then in turn rely on expertise around them and be informed by people who actually understand these things.
And that's not a new idea. That's a concept that, has been informing the way government makes decisions for a long time, but particular, I guess, in the time of COVID, when we hear terms like the science, and they seem like absolute terms, it's really important for people to realize that the science is something that is, experts are involved in and they give advice about. But when a politician talks about the science, maybe there's not necessarily just one thing.
No, I mean, science, we can have overwhelming agreement in science. We can have a lot of agreement, but that doesn't necessarily mean that there isn't more nuance to thinking through these questions. And of course, science is just one aspect that ought to inform decision-making. Politicians aren't technocrats. They're not meant to simply do whatever is scientifically the best thing to do. They're meant to think about a whole host of other interests and values. And some of those are ethical values, right? And sometimes we might think that even if the science tells us that this might be the most effective approach to respond to the pandemic, we might have ethical reasons that are independent to say, well, maybe we ought to think about that in a slightly different way.
Absolutely. And now in your role, let's say with the university, for example, how have you been involved in shaping maybe university policy over the past year and a half or 2 years, I guess coming up on 2 years now, in terms of how we respond to, or how the university has been responding to COVID-19?
So as a university professor, I mean, our job is of course to teach, but it's also to do research. So we're expected to do research and study issues and use that information and knowledge to hopefully inform policy and practice. So my area of expertise is in infectious disease ethics, and I've done a fair amount of work on the ethics of vaccine mandates. So of course, when these sorts of policies are being thought about either in the province or in Canada or even at the World Health Organization level, but even at our institution like Western University, we want to rely on the expertise we have around the table. So I have had the fortune of being able to discuss this with senior leadership to at least inform them of the ethical dimensions of these sorts of policies. It's ultimately their decision about what to do about these things because they're accountable for them. But my role is to provide that advice from an ethical perspective.
Can you, obviously we're not going to ask you to tell us exactly what happens at those tables, but who else has a seat at that table when the institution like a university makes those decisions?
So it really might be issue specific. It kind of depends on what exactly we're looking at. So, you can imagine that if we want to do surveillance of how much COVID is on campus, you might then reach out to the researchers who are studying how much COVID is in our wastewater, right? And could they help us understand how to implement measures like that to inform our response? Of course, we'd also want to talk to people with expertise in ethics, expertise in law, expertise in infectious diseases, and other areas of public health. But critically, when we make decisions that impact thousands of people, we want to have input from the people that will ultimately be impacted as well. So my job as an ethicist is not only to give my expert view on what we ought to do, but to encourage decision makers to reach out and get the input of those that would be most impacted, and specifically those that might be most disproportionately impacted by these sorts of policies, to make sure that we're not going to disadvantage people that are already disadvantaged.
Absolutely. So that's good to know that there is a lot of people that are getting their voices heard, or at least there's attempts to make sure that everybody's voices are being heard when these decisions are being made. We're going to have to take a little break. And then after, we would like to hear maybe a little bit more specifically about, the ethics behind vaccine mandates, which are on everybody's mind here in London, at the university, all around Ontario, and I guess pretty much in the world right now. So please stay tuned. We'll have more with Dr. Maxwell Smith after the break.
This program is brought to you by the following sponsors.
Carbon monoxide is a deadly gas you can't see, smell, or taste.
Homes with fuel-burning appliances and/or attached garages must have working CO alarms installed outside all sleeping areas.
Don't let the silent killer get you. Install working CO alarms today.
Every year, dozens of Canadians are killed or seriously injured because they take risks around railway tracks. Talk to your loved ones about rail safety. Visit stoptracktragedies.ca.
Leonard Thompson, 13 years old, diabetes mellitus, 65 pounds.
Starve the child to let them live. The treatment's as cruel as the disease. It's a death sentence.
Dr. Banting.
This could be it.
He's the first to receive this trial.
But will it save him?
It's not pure enough.
So we try again. And again. And again.
Before the discovery of insulin, diabetes was a death sentence. Banting, Best, Collip, and MacLeod's breakthrough has saved millions of lives. Leonard Thompson's was the first.
You're watching Rogers TV.
Welcome back to LDN ONT TV. I'm your host, Bronagh, and we have been having a fascinating conversation with Dr. Maxwell Smith from the University of Western Ontario and also a member of the Ethics in COVID-19 Working Group at the World Health Organization. So, Dr. Smith, we've talked kind of about like how consultations work, how different levels of government and also the population can influence policy. Let's get now a little bit more specific into the issue of the ethics of vaccine mandates. So I know this is an issue that has been on everybody's mind lately. You've worked extensively in this area and had, I guess, a lot of time to think about it, research on it, talk about it. Let's get your take on the issue.
Yeah, I mean, there's so much to say about it, but maybe I'll start by just stepping back a bit and think about the present context. And the present context really applies to the past 2 years. We can think about what we're facing in terms of the public health threats from COVID. We know that this can lead to a lot of illness, lots of hospitalization, lots of death. We know that this can overwhelm hospital systems if we don't take measures to mitigate the spread of this virus. We know that we're canceling 8,000 to 10,000 surgeries in Ontario every single week. We've seen paramedics not have any units to respond to 911 calls in some jurisdictions in our province. And we've seen things like residents of long-term care homes no longer be able to have visitors or social visits just because of the extent of the spread of the virus. So these are very significant harms that if we did nothing, we would experience. And so that sort of sets the stage for, so what should we do to prevent those harms from happening? What tools are in our toolbox that would be effective? So there's lots of things, of course, that we could do. There are things like lockdowns, circuit breakers, occupancy limits, requiring masking indoors. We can close schools temporarily. There's lots of different tools in our toolbox. Vaccines are one of the most effective ways of reducing the risk for hospitalization. And for the vast majority of people who don't have medical contraindications, vaccination represents a fairly minimal burden, right? It's a fairly simple thing to do as opposed to broad society-wide school closures or lockdowns and other difficult things. And so it's become very attractive, I think, for policymakers to say, well, perhaps requiring vaccination, either in some settings or more broadly, would be the easiest and most straightforward and most effective means of preventing those harms that we don't want to have happen. Now, the response is often to look at the problems with vaccine mandates because, requiring that anyone do something infringes upon their liberty, and that's a harm, right? And sometimes we like to really focus in on those harms and say that's why we ought not to do it. And I'm sympathetic to those views. The challenge is we have to think about what's the alternative, right? If we don't require that people be vaccinated, for instance, in long-term care homes or in hospitals, are we going to experience even worse harms as a result? If we're so worried about the liberty of those who would otherwise be vaccinated, ought we not be worried about the liberty of those who will become hospitalized or die as a result of COVID-19? So when we think about the ethics of this, we have to think about all of the alternatives and say, if this is what if these are the harms that we're presently facing, what sort of policy measures or interventions could we put in place that would be effective at averting them? And then out of those options, which one is the most palatable? Some people think mandatory vaccination is the least palatable. They'd rather see school closures and business closures and other sorts of mechanisms put in place. Others think, you know what, it's just a jab in the arm. It allows us to still go to school, allows us to keep going, keep our businesses and economy open. Let's go for that one. That's more of a palatable option. So that's really representing a lot of the different ethical considerations that occur in this debate.
And I would assume that you have to, in your role, you have to look historically at the impact of mandating, whether it's school closures or whether it's masking or whether it's vaccination. So you have to look at it historically, but you also have to kind of brainstorm about what possibly might happen in future, because, with something, say, new, like a new form of vaccine, the cost benefit is tough to really gauge, isn't it?
Yeah, I think, there's one thing, perhaps we ought to dispel just the safety concerns around vaccines, because a lot worry that requiring that people will be vaccinated because the vaccines are only a year and a bit old, that we might not know what the long-term effects of those vaccines may be. And, I'm not a vaccine scientist or an immunologist, but the evidence suggests that, for all of history, all of the vaccines that we have used, any adverse events that we experience from being vaccinated tend to happen in the first 30 days of being vaccinated, because your body simply dispel the vaccine ingredients very quickly. And so we wouldn't expect there to be new adverse events happening in the future. So that's one of the impacts that we need to think about with mandating vaccines. But we also have to think about, the benefits this will provide in terms of preventing transmission and perhaps severe disease and hospitalizations that would happen, but also the impacts on public trust, right? And perhaps inequities in society. We know that those who are anti-vaccination, putting mandates in place could just further erode the trust that they have in public health and government authorities, and that might not be good overall. So even if we want people to be vaccinated, there's still sometimes measures that would sort of align with that could end up backfiring, having the opposite effect. So that's where absolutely we need to think forward about what we could expect to happen here, look at past instances of vaccine mandates, which have been around for decades, and see what the implications have been there and whether we might be able to put those in place in a manner that's more fair and that could preserve that trust.
Now, I'm not sure if this is something that you feel comfortable commenting on, but how do you think that we're doing? Maybe in terms of a city, in terms of a province, country, or even specifically to your workplace? How is that balancing going with where we are right now?
It's really hard to say. I mean, my personal view is, in Ontario and really in Canada, if you just look at the numbers comparatively to other jurisdictions in terms of the number of cases, the number of hospitalizations, the number of deaths, Canada tends to fare pretty well in relation to other jurisdictions. But, it's a lot of it doesn't have to do with which measures should we put in place. A lot of it has to do with when we put them in place. It's very, very easy for a politician, decision maker, to wait until our ICUs are absolutely full to say that is enough justification to put in pretty aggressive measures, because it's very hard to deny that those measures would be justified because our hospitals are overwhelmed. It's so much more difficult 3-4 weeks in advance of that happening to say we must put those measures in place now in order to prevent that from happening, because we can't point to the evidence of the hospitals being overwhelmed to justify that. So I think we're doing well if we compare ourselves to other countries and other jurisdictions, if you look at things like deaths averted and hospitalizations averted, but there's ways we could do even better if we were to simply be more proactive in our response to this pandemic.
And, I'm, the host of a cable TV show. One of the, I guess, bigger criticisms has been the way the media has kind of taken a role in kind of spinning how people accept or don't accept government decisions and, moral judgments and everything with respect to mandates in any way, shape, or form. What can people like me and maybe our viewers do to kind of maybe digest this information a little bit more rationally?
Yeah, it's a really good question. And even for experts, I think the lesson should be humility, right? We have to appreciate that these are incredibly complex states of affairs, incredibly complex policy decisions. Being on the other side of it, where I have advised governments, it's profound how many different interests, needs, and information are out there that you need to weigh and sort of comb through, and then all the practicalities of how you'd actually implement some policies such that they work. So even if you believe very strongly in a particular position, that doesn't necessarily mean it's workable in policy and practice, or that this would work well if you were to implement it in your public. And so part of it is taking a step back, I think, even for experts, and saying, look, things are complicated. Let's give a little bit of the benefit of the doubt to those that are making these decisions. They're really, really tough. You're not going to satisfy everyone, no matter what you do. And so we need to understand and appreciate some of the complexity involved here.
Absolutely. And now, the people who have to live with these decisions ultimately longer than me, as somebody who's 51, are young people. Talk to me about some of the mandates that have impacted young people's lives, and maybe something encouraging or ways that they can get involved and make sure that their voice is considered.
Yeah, I think, all too often we see things as binary or dichotomies, right? And school closures is a great example of this. Either you close schools or you keep them open. There's advantages and disadvantages on both sides of this, of course, right? If we let a pandemic virus sort of transmit unmitigated, this is going to have profoundly bad effects on children and their families. If we close schools, that can also have profound effects on children and families. And so I think what we need to do a better job of, and this is really owing to the previous point about really understanding the complexity of this, is not simply to take one of those polarized positions, but understand that if we want to do something, if we really want schools to stay open, it's not enough simply to argue for that particular conclusion. It's to say, how do we do these things that try to understand and perhaps acknowledge the different values at stake here? How do we do this safely? What are the sorts of mechanisms that need to be put in place to make sure that those who might be most disadvantaged, immunocompromised kids, for instance, don't feel like they're putting their lives at risk when they come to school? If we think through all of the different values and perspectives on the table here, I think that's the way we can be optimistic and see a way forward, so that we're not totally divisive about every single issue that emerges in this pandemic response.
Fascinating. I wish we had much more time to chat with Dr. Maxwell Smith, but thank you so much for your perspective. Thank you for all of the great work that you have been doing behind the scenes and I guess in front of the scenes today. We hope our viewers will stay with us. We have more to talk about after the break with a young person and getting their perspective on this issue, so please stay with us.
This program is brought to you by the following sponsors.
Sometimes it's hard to say goodbye to an old friend. But when you're saying farewell to your vehicle, Kidney Car makes it fast and easy. Just call or visit our website. We'll take any vehicle in any condition and give you a tax receipt for a minimum of $300. No headaches and no towing charges. It's the one-stop solution for getting rid of your unwanted vehicle in just a few short minutes. When your vehicles reach the end of the road, call us toll-free or visit kidneycar.ca.
Jeff from Chillin' and Grillin' with Jeff. We're back for season 3. We've had the opportunity to see some great backyards and have some great barbecue. Join us, Chillin' and Grillin' with Jeff.
Night's action on Rogers TV.
You're watching Rogers TV.
Welcome back to LDN ONT TV. For our final segment, I'd like to welcome to our show Leo. Leo is a 17-year-old high school student, soon to be graduate of high school here in London. We've been talking, Leo, today about, some of the ethical issues behind some of the ways that public health, governments, institutions like the university here have reacted to COVID-19 and kind of weighing, how to keep people safe with restrictions on people's liberty. Obviously, the decisions that people have made, from the adult community over the last couple of years have really impacted how you've, experienced school, socialization. Talk to me a little bit about, your take on this issue.
Well, first of all, thanks for having me on the show, Bronagh. It means a lot. The whole issue is kind of like, it's insane. It's kind of out of my reach, and it's definitely affected a lot of variables and a lot of factors for my life. Like school it's an obvious factor to talk about, right? Schools got shut down. And it's just the learning process of school, like online schooling, is kind of a mess because there's people cheating behind their screens. Well, don't tell the.
We're not naming names. Not naming names.
No names, but there's a lot of other stuff going down, and it's not really reliable. There's people that they just log into a meeting but don't actually do anything. And there's it's like online schooling is like being there without being there, and you can't really do that. School, when school was allowed and then everything else wasn't, at least there was some sort of thing to see someone else, but and we'll see how long that lasts, but it's going to be good to reconnect with everybody again.
And the constant changing, that must have been pretty challenging as well, just going back and forth between the two different systems.
Definitely. You kind of reconnect on, I reconnect again. It's like, oh, how are you? The 2 weeks, especially alternating online and offline, you're changing your time schedule, right? When you wake up, when you go to bed, what are you doing? It gets mixed up a lot because of that.
Absolutely. And I think we're all, like you, hoping for some kind of maybe normalcy, return to something like normalcy or some kind of consistency in the next.
Consistency, that's the word, not normal.
Absolutely. So thanks so much for being here, Leo. The voice of young people is so important, and it's good to know that people like our first guest are listening to all kinds of voices, including our young people, when they're making these hard decisions during the pandemic and going forward. So thank you again for joining us. Thank you to our guest, Dr. Smith, as well as our viewers for tuning in. We hope you will come back again for more LDN ONT TV next week. Take care.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
When it comes to drugs, how much freedom is too much for kids?
Drugs are out there. Will my teen feel free to say no around other kids?
I didn't live drug-free when I was younger. Can I admit that to my kids?
Drugs worry me, but how can I feel free to talk about it with my kids?
Questions about drugs and kids? Drug Free Kids Canada.